We are pleased to welcome you to today's webcast, Bagels and Blockchain, How Blockchain Technology is Being Used in the Fight Against COVID-19. Before we begin, we wanted to go over a few housekeeping items. For the best viewing experience, we recommend using a wired internet connection and closing any browsers and VPN running in the background that can cause issues. The webcast is being streamed through your computer, so there's no dial-in number. At the bottom of your screen are multiple application engagement tools that you can use. All widgets can be moved, resized, and also minimized completely, so feel free to customize your desktop space as you see fit. If you have any questions during the webcast, you can submit them using the Q&A widget at any time during the presentation. We'll do our best to respond to your questions, but if we run out of time, we'll connect with you after the webcast. Additional resources are available in the resource list widget at the bottom of your screen. We would also appreciate if you would complete our evaluation survey after our webcast using the survey widget at the bottom of your screen. Today's speakers are Sarah Albright, Consultant, EisnerAmper, Paige Krieger, Digital Engagement Program Manager, Blockchain Platform, IBM. I'll now turn it over to Dara.
Great. Thank you, Lexi. And thank everyone for joining us today for this next episode of EisnerAmper's Bagel and Blockchain series. I hope everyone is staying safe and healthy. Really excited to be here today. Given the current COVID-19 crisis, we thought that we'd discuss ways in which blockchain technology is making significant inroads in the medical field. And with that, I would like to introduce our speaker, Paige Krieger, Digital Engagement Program Manager at Blockchain Platform IBM. And Paige, it is great to have you with us today. Thank you so much for joining.
Thanks for having me, Dara. It's great to be here. And thanks everyone for joining. I'm really excited.
Do you want to start off to a little bit about your background and introduce yourself, and then we'll jump right into some questions?
Yeah, sure. So my name's Paige Krieger, as they mentioned, and I'm usually based out of Dallas, but coming to you from Phoenix, Arizona as we speak. And I've been at IBM for 3 years now and focused on blockchain since the beginning. However, I feel like right now, and considering the current situation in the world, blockchain has become more relevant than ever. And it's really drawn an emphasis on the need for transparency and visibility and ultimately trust in all the interactions that we have, whether it's with businesses, with each other, or just with the environment in general. So I've really enjoyed being able to learn and research how blockchain, both within and outside of IBM, has started to be applied. So I'm really grateful for the opportunity, excited to be here, and look forward to answering your questions and connecting afterwards.
Yes, thank you so much. Okay, so let's jump into some questions. Can you start off, maybe discuss some of the ways in which the healthcare industry has started looking to blockchain to improve some of these efficiencies? And feel free to cite use cases if you like.
Yeah, so I think the first thing I want to address is just the traceability aspect of blockchain and the ability to leverage that to track donations, medications, and most importantly right now, medical supplies. And so as we have so much data, the most foundational thing that we need right now is to add the trust, the immutability, and the transparency to that data. And that comes with being really crucial in tracking initiatives on the cases, on potential treatments, and even on human movement. So whether you're working at a hospital or you're a first responder, government entity, supplier, all of these different players need a database where this data can be stored, trusted, and as you probably have seen on the news, the information is changing quickly and there's different sources of reporting. So even some of the most trusted sources like the Weather Channel or like the CDC have differing numbers of cases, of deaths, of outbreak areas. And so it's really important that we have a single source of truth that's trusted, verified, and that we can rely on in this time of uncertainty. So with this distributed ledger, it takes out the aspect of a traditional database, which is a single administrator on the back end, and there's potential for human error, there's potential for misinformation, and even fraud in the worst case scenario. So I think that blockchain as a whole is really addressing the needs of both businesses and consumers. And so with all these different variables, we really need to commit to accuracy and allow the professionals who are on the front lines to be spending time worrying about solving the problem and not on whether the data they're being supplied with is in fact true. So to get to more specifics, I think the first and most common use case that I've been reading about and that IBM's been involved with is around supply chain, specifically for PPE tests and eventually vaccines. So ensuring that the resources that we do have are sent to the right place as quickly as possible, and that there's nothing on the back end that's slowing down these processes. Another one that I really think is important is around medical records and digitizing these and even making them self-sovereign so that patients will have control over who has access to their data, and they can even decide to open up their data to be used in clinical trials. So that would give the patient more control, but also greater access for the common good. And when mentioning clinical trials, I think it comes down to the phrase of the whole is greater than the sum of its parts. So we have all these great research institutions that are doing work in a variety of locations, but if they're not sharing their findings, then we're potentially duplicating efforts and slowing down the process and the progress toward finding a vaccine that will eventually mitigate the number of cases and potentially prevent deaths. We can look to credential verification, which is important as so many medical professionals are coming out of retirement or going back. If they have switched to another career path, they're volunteering. And so being able to verify that they are in fact certified to be playing these roles and they're still have valid credentials, that's an important aspect. Donation tracking, whether it's charity or even blood plasma, there's a variety of use cases there. And then lastly, insurance claims. I think that's going to come to play more as we start to recover from this, but at the same time, just being able to have a blockchain-based system. I know Ant Financial is one example of a company that's using their already existing blockchain claim sharing platform. They added functions specific to coronavirus, helping to reduce paperwork and basically eliminate the need for the back and forth delivery of documents through this digitization.
So it's interesting. So what I'm hearing is that the blockchain used in healthcare really runs the gamut. I mean, it's everything from coming together to create a vaccine, and to store clinical trials, to patients controlling their own healthcare records, to donations, as you say. So. And supply chains, which is, I know, a big topic of conversation now. So maybe we dive in a little bit into some of these to give a little bit more of a broader perspective. So you had mentioned, and I guess the first one was interesting because we had met actually at an event, the Digital Asset Strategy Summit in October. I saw you speak, and you used the phrase on the panel talk, which I thought was fascinating, talking about this concept of patient passports. And could you describe what you mean by that, what it means to have these like digitized patient records, and how that might impact the future of healthcare?
Yeah, so I think patient passports is something, and I'm sure there's a startup or a corporation out there that has patented the term, but I think it's something that describes the ability to not only control and have your data in one place regarding your medical and your vaccinations and immunity and all of that, but also to be able to permission access to providers on an as-needed basis. So just like you use your passport to validate your citizenship, you would use your patient passport to validate your vaccinations, to validate that you have indeed tested negative and that you have the antibody test or whatever it might be coming out of this. But at the same time, it prevents every time you go to the doctor, you're having to fill out so much paperwork. And if you go to a different doctor, that doesn't transfer over if they're in separate systems. So it's really a matter of increasing the efficiency, granting greater privacy, and then just relying on decentralized self-sovereign identity, and you can increase the access of your information if you're willing to do so. Like I said before, if you want to contribute to the research in a clinical trial, that's one piece. But then also if you want to be notified, if you've been in an area where there was an outbreak or you may have come in contact with someone, that could be leveraged and also connected with your digital patient passport. So I think those are some really important facets, and one that's especially crucial right now is in case of emergency. And I believe it was Walmart who was working on this previously, but basically it would be something that could be stored on, say, an Apple Watch or anything that you carry with you, even your phone. And in case of emergency, these responders could get access to just the most pertinent records, whether it's your allergies or pre-existing conditions, so that if you are in this situation, they can assist you as necessary and really be notified of these conditions, which you're not able to do if you're incapacitated at the time. So although it may not be as COVID specific, since a lot of times these symptoms are a gradual onset, it still could be used after COVID and for other emergency response situations.
It's interesting, and it's also because the patient actually owns their own data, so they could basically approve of what elements of their of their health background or their health file that they actually want to share. Is that correct?
Yes, exactly. So in some cases, there could be monetary rewards for that. It just depends on the need for the data and who's requesting the data. And then also, I think the temporary permissioning is a huge piece, because although patients could own right now, it would be without blockchain, you would basically have to grant access to all of the data indefinitely, but with blockchain, you have that kind of permissioning aspect. And also you can determine to what degree they can see. So maybe they just see at a high level your pre-existing conditions and your allergies, as opposed to all your vaccination records, all of your doctor's visits. And then when it comes to connecting across different medical providers, they can potentially be seeing more of a continuous record as opposed to just their siloed record of your visits to their practice.
Right. I mean, it amazes me that right now that they're not completely connected. I mean, that's just, it's kind of mind blowing. Let's jump in a little bit into the supply chain, because that's really been a big, that's really been newsworthy lately. People are talking a lot about, especially when it comes to medical supply chains in the news, and where our medical products are coming from, different parts of the supply chain. And I know that there are issues with that. So how does blockchain, how is blockchain used to actually help that or fix that?
Yeah, so I think it all starts with the data gathering, tallying the data, reconciling the data across databases, and then allowing this data to then dictate what our next steps are as far as getting that inventory out to the right people, working with the right suppliers. As supply chains are today, they're reactive, they're not proactive, and that's because they lack this visibility and this accountability that blockchain provides. So if we have more proactive and reliable supply chains, we're able to give that visibility and establish a trust in the transaction accuracy, because there's numerous parties verifying that this is indeed true. And the key piece that I think isn't addressed as often is that we all heard about how there were fraudulent test kits sent out. Well, with blockchain, if you're combining that with EDI technology and IoT and different aspects of technology that already exist, you can verify that the goods weren't exchanged or tampered with along the supply chain, so that, sure, we can expedite the supply chain, but if we're sending faulty goods, then it defeats the whole purpose. So smart contracts will have a huge role in this, because they can be implemented for payment. So for anyone that's not familiar, the way that I like to describe smart contracts are, as opposed to just a digitized contract, it's essentially an if-then statement embedded into code. So if Dara pays me, then this shipment gets sent. So that's an oversimplified way, but I think it's important to kind of clarify what the role of smart contracts would be. And it's just eliminating a lot of that manual approval process that takes a lot of time. Freight documents, they've already been in the process through solutions like TradeLens, like Marco Polo, they've been essentially leveraged and digitized, but if we were to expand these to encompass more suppliers and more companies and consumers, then we'd be able to expose this transaction data, GPS coordinates, timestamps, whatever it might be, and then be able to get quicker access to relevant information. So last but not least, I think the privacy aspect of different suppliers, and I'll touch on this later, but when you're working with unknown suppliers, it takes time to establish that trust. Whereas if they know that their transactions are going to be private and only exposed to those that they pertain to, then they're more willing to collaborate in a quicker manner rather than taking that time to go through the vetting process.
Interesting. And especially, you know, I know that IBM in the past had done, participated in the Mango project. You know, years ago, when a couple of years ago, when they were looking at the origins of mangoes, and I know we had issues, you know, on shelves with romaine lettuce and having to go back and you know, basically all the lettuce was taken off the shelves and all that money was lost because you couldn't really go and figure out which came from, you know, the bad farm or whatever it was. So you can imagine also just with medicines. You know, if all medicines around the world were, you know, the medical supply chain was put onto the blockchain, you know, if there was a recall and, you know, any kind of, you know, any kind of a medication, even over the counter, you know, we would be able to instantly be able to go back and pull that from the shelf and make that, you know, more efficient.
Exactly.
So,
and that kind of pulls in an example of what's being described as crypto anchors. And I know that this is something that IBM iX and research has been working on, but essentially it's basically a chemical signature, or I call it kind of invisible ink, that would be on these prescription or these medication pills. And you'd be able to validate with something like a lens on your iPhone or even an application, whether or not your prescription or your medication is fraudulent or is in fact what you think it is. And so there's been so many issues, especially in developing countries, with counterfeit drugs, that if you're able to allow the consumer to validate for themselves that what they think they're taking is actually truly what they're taking, then we're able to mitigate the risk of a lot of the fraud and the tampering with the medications that currently exist. So when it comes to a vaccine, that could be important. When it comes to test kits, that could be important. Just another aspect that takes what Food Trust did with the mangoes to another level.
Yeah, that's amazing. So speaking of vaccines, because I know that's really on everybody's mind right now too, what can blockchain, you know, how could blockchain be used to expedite a vaccine?
So I think it's kind of indirect in that blockchain would be helping to bring visibility to the findings of all of these tests and research centers that are, I guess, simultaneously occurring and maybe not cross-communicating between. So if we're able to, I go back to the whole is greater than the sum of its parts. If we're able to bring one place where this data can be shared and leveraged by a variety of institutions, then say there is a finding or there is a successful vaccine, we can get it shared more broadly that much quicker, and we can enable people to get the vaccines out to the areas that are most affected. So we're pulling in data from the Weather Channel or all of these different sources that are showing kind of hotspots of the infection. And then we're saying, okay, let's get these vaccines here. So it pulls in supply chain, it pulls in clinical trials, it pulls in really all these different aspects that we've touched on, and it's going to expedite availability and the efficiency of getting it out. It may not necessarily expedite finding a vaccine from the get-go because blockchain doesn't solve all problems. But as far as the execution piece, I think that it's going to improve the efficiency and ensure that when vaccines are sent out, they're in the right place at the right time.
Yeah, well, it's interesting also because now we're seeing all these clinical trials of even just treatments. And there are many of them happening, you know, in all parts of the world. And it's interesting because now really the whole world is kind of unified in looking for, you know, whether it's a COVID-19 vaccine or, you know, treatments. So with all of these clinical trials that are going on, how is blockchain being used to improve the veracity of those clinical trials? Because that's been an issue. You read and you're trying to figure out, okay, how accurate or truthful is this clinical trial versus another? Are they communicating with each other?
Yeah, so I think if these were to be on a blockchain-backed system, that would eliminate that uncertainty, at least to a degree, and it would enable patients to permission their data like we were talking about. So if the patient themselves was verifying that, yes, this is my data, I was part of this clinical trial, and I'm allowing it to be published, you're verifying it from the source as well as from the medical provider, as well as from the research institute, wherever it's coming from. And then since there are on a blockchain multiple sources of verification, validation, it also increases accountability. So it makes people and organizations less likely to post false information because it's available to the community and it's something that could be called out if in fact it contradicts other findings. So I think it's just shining a light on the findings and making sure that people know that what they put out there is in fact up for debate and could be contradicted because it's visible. So it just holds people accountable. It's more of a transparent way of doing this research and then exposing findings from clinical trials to then draw parallels between these different trials and potentially connect the dots at a more rapid pace.
So right now, how it's done is basically, doctors or going out there, they're performing, scientists performing clinical trials, and then they're, writing about it, writing reports or studies and sharing that. But the accuracy or the truth, you don't really know. And it's at least if it's on the blockchain, it can't be changed. It can't be, it can't be tampered with. So, exactly the patient, the age, any underlying condition. I mean, every single, factor that they would need to know is all in there embedded into the technology, into the blockchain.
Exactly. And it's important to note that it might not necessarily be stored directly on the blockchain, but it could just be a fingerprint of that data or what they call a hash that's then can be called out to the database where it's stored, depending on different GDPR, PPI, whatever it might be, involving personal information and the degree to which the patient granted that access. But it's also important to note that in the case of permission blockchains, everyone has an identity. So it's not like a Bitcoin blockchain or an Ethereum blockchain where all of these are anonymous. It's going to show who published that information, when they published it, and then if for some reason there is some contradiction or a change that needs to be made, it's like taking a test in pen. So it's going to cross out the initial information, but it never erases anything. It just crosses it out and then contradicts it with the truth. So it gives this audit trail, it brings transparency, and also it provides identity, which is really key.
So it's interesting because the COVID-19 pandemic arrived at a time when blockchain was, really kind of first emerging, in using it in healthcare. So, but now we're really learning more. We're becoming smarter. We're starting to use it. Do you think that because of what we're learning now from using blockchain within, within this whole crisis and what we're doing, that blockchain may be used to help mitigate the impact of a future pandemic?
Yeah, I definitely do. I think that although it won't prevent the emergence of one, because that's inevitable, it creates the first line of defense through a network of connected devices that are then backed by trusted data sources. And so it can help to decelerate pandemics by enabling early detection, fast response, and fast tracking these drug trials and vaccine distribution. And it really just assists with treatment management and having a more holistic view of the number of cases, the number where treatments have been found, what's been successful, what hasn't been, and then digitizing records in general. I mean, it's the concept of digitizing paper-based processes that's really needed. So it makes the supply chains more resilient to these future shocks that'll come from future pandemics.
So it's interesting. It's almost like right now where we're kind of building the foundation So we're getting everything set for, what to do in the future. It's like we press a button as opposed to, we're kind of building it now. So we're still in that process. So what other areas do you think of the healthcare industry are expected to have the most impact from blockchain technology?
So I feel like I kind of have been echoing just the ideas around supply chain, PPE, and then mainly just enabling stakeholders to connect more quickly with the suppliers that they may not have traditionally worked with, enabling the track and trace of goods, the authentication of goods, document management, ownership transfer, all of the above. And then just looking at demand planning and being able to say, okay, this is how much we're getting from a demand side. Where can we fulfill these needs on the supply side? And then enabling the suppliers and the end consumers to be more connected. So that's the biggest piece, I think. And then around digitization of medical records, that's going to be huge. I mean, that's something that, whether there was a pandemic or not, is critical and is needed. And I think it's just really accelerated progress in the healthcare industry, and hopefully shined a light on the need for this and the need for it sooner rather than later.
Yeah, it's going to be really interesting just to see how the whole healthcare industry is really, it's undergoing this incredible transformation right now through technology. Even, I know people are talking about telemedicine. I mean, just even, with that. I mean, I during this quarantine, I had 3 telemedicine appointments, and it was great. They were like 15 minutes long. I didn't have to leave my house.
Exactly.
It's pretty amazing, just kind of, the role. And I think we're starting to really understand now and realize just how significant technology is to our lives. So it's really kind of interesting watching this whole thing unfold. What efforts is IBM directly? I know you guys have been doing so much in the space, and in not only healthcare, but just in the blockchain. Using blockchain for a number of industries. Can you talk a little bit about some of the efforts that IBM is directly contributing or spearheading with regards to blockchain? And you could talk about, within, broadly or even specifically with COVID-19 relief efforts.
Yep, and that's something that I think all of us as IBMers and hopefully others in the tech space have been seeing a bit of the involvement around dedicating supercomputers to expediting different potential chemical combinations that can help combat the virus, or looking at working with the weather company to create. Now, if you go on weather.com, you can click a COVID-19 tab and search by county and see how many cases there are, how many deaths there are, and really just providing visibility that we wouldn't have necessarily had if it weren't corporations like IBM and many others that are stepping up to join in the fight against COVID. And so I think I want to touch on 2 main things that are COVID specific. The first being a relatively new and rapidly expedited project called Rapid Supplier Connect. And that's something that combines IBM blockchain and IBM Sterling, which is a supply chain inventory visibility solution. And so we're we're working with one of our partners, Chainyard. And so this is a collaboration between a lot of different entities. And the whole idea around it is imagining a network where individuals can be identified, their healthcare credentials verified, and then on the back end, all of these non-traditional suppliers are stepping up to meet shortages. And so this solution combines validated source of identity from our Trust Your Supplier solution with real-time inventory availability and visibility from IBM Sterling, and it helps buyers match and work with new suppliers that may be not necessarily ones that they've traditionally worked with. So take Ford, for example, in their manufacturing of ventilators. They don't typically work with the suppliers of the parts that make up a ventilator. So how can they more quickly validate the identity of the supplier, establish trust with them, and then even execute the onboarding and the transaction process with them? So that's really the purpose around Rapid Supplier Connect. And the best part about this that makes me most excited is that this solution is being offered for free at no cost for the first 120 days. And so any suppliers, no matter how big or how small, can onboard to the Rapid solution. And there's actually a dedicated team to help with that onboarding. And it's really going to help goods move faster, but that's because of the efficiencies that are being made on the back end, especially when you look at cross-border, where there's even more trust that needs to be established and more, I guess, legal and best practices that need to be shared and agreed upon before these processes can be executed. So it's really a great effort. It's more corporations are getting involved, and I'm really excited that IBM's spearheading it in collaboration with Chainyard.
That's amazing. So is that already in progress now? Has that begun? And use the Ford example that you use, is it being done to use, for example, in the manufacturing of ventilators?
So I'm not positive on who's onboarded just yet, because I think that's been kept proprietary for now. I know that there's a press release coming out most likely on Monday that'll mention more of the participants. However, in the resources section, I did include a link that explains more about the Rapid solution. And then at the IBM Think conference that's happening digitally, May 5th through 7th, there's going to be a session that expands upon Rapid Supplier Connect, how to get involved, and just the different steps that suppliers can take to contribute.
That's amazing, because it's not only making things more efficient and expediting, the manufacturing process. It's also democratizing supply chains across the globe. So, I mean, that's really fascinating too.
Yeah, and just the fact how quickly it's come together is what's really mind-boggling to me, because we're just pulling together existing solutions, collaborating with different innovators and companies across the space, and enabling something that's at no cost, which is pretty much unheard of when you think traditional IBM. So,
yeah, that's amazing. So we have a couple of questions that came in. Let's just jump to a couple of audience questions. Here's one. How difficult is it to onboard all parties, hospitals, and their ability to provide counts and status to a blockchain network? Considering building a network or participating parties is a challenging task.
And that's a very fair question. So I appreciate that. And I hope that by explaining the Rapid Supplier solution and by looking at it, that will bring light to some of the processes that we're trying to standardize and expedite to make that onboarding process easier. I think one of the biggest hurdles, and this is what I've learned just being in blockchain in the past 3 years, is that getting everyone to agree to standardization, to governance, if that's already pre-established, it makes the onboarding process and the progress of the network that much quicker, and it goes that much more smoothly. So I think when you have a pre-built solution that customers can just onboard to, and we've seen this with IBM Food Trust too, there's different modules that they can join, or there's different aspects of the network that they can participate in. So by making it more of a standardized solution, that enables more rapid onboarding. And then also with Rapid Supplier Connect, I mean, there's a dedicated team of people that are answering calls, that are getting the right people connected. And then it's really creating a profile that's standardized. And in 15 to 20 minutes, you can have a company as a supplier uploaded onto this portal. So it's making the information readily available and having a stage set so that the players can just jump right in without having to go through establishing the governance and the standards and incentive models and all the things that make blockchain networks more complicated and more timely. In situations like this, the players are willing to give access to their data if it means that they're going to benefit the well-being of everyone as well as the industry. So yeah, I think it's just a matter of collaboration and cooperation that, combined with the technological advances, make it a simpler process than typically perceived.
And how do companies find out about this, to know to go and register or apply, to participate in that?
Ideally, it's just through word of mouth, press releases. Yeah. Hopefully, it'll get some media coverage just to, I think that since cost isn't a barrier, it's really something that it doesn't hurt. And if you at least try it out, you can see how much visibility it provides. And I think that hopefully IBM Chainyard will do its part in spreading the message, and through even webcasts like this. I mean, it's just a matter of sharing with people that this exists, and then also encouraging involvement and not putting up any cost barrier that could prohibit them from doing so.
Well, I'm glad we're doing this, because at least, it's something to at least kind of, get the message out there and because there are a lot of companies, within the supply chain, as you said, that this is all, there are new companies coming in to manufacture, just in the ventilator example, and they don't have those relationship with those suppliers, and now here that's just opening up even new future business as well, and establishing new relationships. And I think that's fantastic. Okay, we have another question here too. We can jump into that one. This one, how much of what's being discussed actually is in use right now in healthcare of the technology, and how much is just theoretical use cases? How quickly are use cases moving towards actual implemented technology solutions?
So I think there's kind of two different categories. I think when we talk about the supply chain initiatives, like I said, Rapid Supplier Connect is a real live solution. There's companies participating. There's opportunities to onboard and get involved. There's another project that I actually wanted to touch on too, that's an example of something that's real, it's live, and you can get involved in it today. This is more so a call for developers and what the project's calling data warriors. So anyone that can contribute data to this project, which is called MiPasa. And that was a partnership that started with Hasera, IBM, now involves Oracle, Microsoft, the World Health Organization, Johns Hopkins, different governments like Canada, China. And so it's really pulling together a bunch of different players. And what it is a data hub that aggregates, validates, and then shares that data so that applications can be built by developers on top of it. So it's written on top of Hyperledger Fabric. It's running on IBM blockchain platform on the back end. And the whole point of it is to facilitate quicker detection of transmitters, hotspots, and then secure and integrate data sources that are typically disparate, and allow the community to recognize errors or misreporting, and then combine the reliable feeds. Because even if you look at the CDC and what they're reporting versus what's on the Weather Channel versus what's coming from the World Health Organizations, the numbers differ drastically. So it's like, for any of these solutions to really be built on trusted sources of data, that's why blockchain's needed. It's on the back end. It's not necessarily something that everyone's contributing to. It's just leveraging something like MiPasa to build applications on top of, so that those applications are relying on trusted data. I think when it comes to digitizing medical records, I know that there's various projects in the works. I know that there's numerous startups that are working on that. I think that although some of them aren't necessarily 200 network members like IBM Food Trust, they still are gaining traction and getting visibility because of the current situation and the need for them. So I think that the answer is yes, some are theoretical, and yes, some are in action and can be participated in as we speak. I think that the technology is there, like to be able to track a mango back to the farm it was grown on. That right. Technology can be applied to track a vaccine back to where it was produced, or to track data around a clinical trial to see who contributed that data to the findings. So the foundation is laid, and like Dara, you were saying, I think that step had to be taken, and it's going to take longer for certain solutions than others. But I mean, there's the end goal in mind, and I think there's the vision, and now there's the need that the industries and the governments are recognizing. So it's just a matter of time before these solutions that are currently theoretical use cases become actionable solutions.
It's interesting, and just in case the audience didn't know, just with respect to the Mango project with IBM and Walmart, I think when they tried to find originally the origin of the mango, It started off, they gave each person in the conference room sitting along the table a mango and said, tell me the origin. And they came back, and it took them probably, a couple of weeks or whatever it was. And when they moved to put it on the blockchain to test it out, it took like all of 2 seconds or something like that to discover the origin. So you just, you could just imagine the impact that this could have when you look at the supply chain just from the medical side. It's fascinating, really. Where can attendees and participants, people in the supply chain, where can everybody learn more?
So there's definitely in the resources section that you guys will see on your screen, I've linked a few different things. The first being the blog post around MIPASA, and then that explains kind of the thought process that went in. And then I also included the MIPASA Direct website, which is where you can click, it says Call for Data Warriors at the top, and you can figure out how to get involved. It's through the Hasera Unbounded network, which is also something, if you're in the blockchain space or just curious about projects going on in the blockchain space, it's something almost like a Yellow Pages or a directory of blockchain networks, not just Hyperledger Fabric, but any of the protocols. And you can search it or post your project there and see if there's others working on similar initiatives to either collaborate with them or see how you can potentially leverage what they're working on. So it's a really interesting thing. That was a side note. So back to the question. I think that looking at those different websites, and then our Think digital event is actually free this year. And so it's a day's worth of content, whether it's live sessions that are hands-on technical labs, where you can actually use the IBM blockchain platform and others of our solutions, or there's on-demand sessions. And like I said, one of the sessions is strictly around MIPASA and Rapid Supplier Connect, and they're going to talk about how the projects came to be, how to get involved, and more detailed steps. So hopefully the links that are provided can give you some direction as to where to sign up or how to get involved. And then obviously, feel free to message me. I'm on LinkedIn, I'm on Twitter. I believe those are both linked in my profile. So feel free to reach out. I can get you connected. And I think it's really just important that everyone do their part. And even if it's just spreading that these initiatives exist, word of mouth, that's half the battle. So hopefully you guys will join us in doing that.
Wow. Thank you so much, Paige. This was incredibly enlightening. And I'm actually looking forward to sharing this video, even on my personal Facebook page, because I've had friends that, have, because of this, they, have businesses that are in the manufacturing space, not related to, medical supplies, but started getting involved in that to help out, especially given, what's going on. So this was incredibly enlightening. And I really thank you for joining us today. So this was terrific.
Yeah, well, thank you. Thank you so much for having me.
Yeah, thank you. And thank everyone for joining. And I see Lexi pop back in. So thanks, Lexi.
Yes, and thank you, Paige and Dara. And thank you, everyone, for taking the time to join us. We hope you enjoyed today's presentation on bagels and blockchain, how blockchain technology is being used in the fight against COVID-19. The recording of today's session will be available on demand later today and can be accessed using the same link that you used to join. We would also appreciate if you would complete our evaluation survey, which will pop up at the conclusion of this presentation. So please keep the window open. And with that, thank you all for joining our webcast today.